Everyone feels sadness. It's a natural human emotion. However, clinical depression is a serious condition that can have a profound impact on every aspect of our life. There's one more kind of depression which is called situational depression. Situational depression and clinical depression are similar but not same. Recognizing the difference between these two types of depression is the first step towards getting help. Let's learn how can we differentiate between these two. The most obvious difference between clinical and situational depression is the severity of the condition. But both can present significant challenges and threats to our well-being. And by knowing type of depression, we can support recovery. So let's learn how can we differentiate between these two. Situational depression is medically known as adjustment disorder with depressed mood. It is a short-term, stress-related type of depression. It can develop after we experience a traumatic event or a series of events which give us a lot of stress. And as it is an adjustment disorder, it can make it hard for us to adjust to our everyday life following a traumatic event, and it often resolves with time. However, clinical depression is medically known as major depressive disorder. Clinical depression or the major depressive disorder is a type of mood disorder. It is more severe than situational disorder, which can impact our daily functioning as well. Factors that can lead to situational depression are relationship or marital problems, relocation or situational changes like retirement or having a baby, financial issues, death of a loved one, social issues, medical illness, life or death situation, living in a dangerous neighborhood, or traumatic childhood experience. The factors which can lead to clinical depression are disturbance in level of chemicals such as neurotransmitters. Genetic factors may also influence. Major life events can trigger negative emotion or alcohol or drug dependency. Symptoms of situational depression and clinical depression are almost same. A person can experience sadness, hopelessness, frequent episodes of crying, sleep disturbance or change in appetite, lack of concentration or withdrawn from normal activities, loss of energy or suicidal thoughts. But the diagnosis criteria is different for both of these, such as in situational depression, you have emotional or behavioral symptoms that develop within 3 months of a stressful event, due to which stress can cause severe issues in our interpersonal relationship. And these depressive symptoms are not caused by some other mental health condition. Whereas in clinical depression, a person must meet the criteria in DSM, which says a person must show symptoms from the specific list of criteria for 2 weeks or more, and the symptoms should be present mostly every day. These symptoms should be severe enough that they subsequently reduce the person's ability to perform regular duties or routines. The treatment differs in both the situation. As situational depression is a mild form of depression, it often resolves without active treatment, but some form of activity or exercises are good for your mental health. So it is suggested to do some lifestyle changes for your situational depression. But if you feel that it is going out of your hand and you are not able to handle your depression, then I will suggest you to consult a professional. Whereas in clinical depression, it needs a proper treatment which may include medicines and counseling or therapy. Clinical depression needs long-term management, whereas situational depression can be sorted in short-term treatment. As I've already mentioned in my previous videos as well, that depression is one of the common form of mental health condition in India and all over the world. If in case you feel you are going through depression, then please consult a professional to diagnose what kind of depression you may have. Thank you so much for watching. Be sure to give this video a like and subscribe. We will meet next week with a new video on mental health, so stay tuned. Till then, wish you a healthy mind and a happy life. Bye bye.